heart and vascular portion of the physical assessment, and I'm going to inspect for PMI. That's basically me inspecting to see if I can see the heart beating just by observing her chest wall. Next, I'm going to auscultate the S1 and S2. So the aortic, pulmonic, Erb's point, tricuspid, and mitral. So S1, S2, and we're moving down, tricuspid, and mitral. All right, and next I'm gonna ask my patient, I'm moving on to the abdomen. I'm gonna ask my patient, do you have any history of distress with your GI?
No.
Okay. And I'm going to ask her about her bowel patterns and bowel movements. Are you frequently going to the restroom on a regular basis?
Mm-hmm.
Okay. And I'm going to ask her about if she's noticed the color, any abnormal odors, the amount, and the consistency. Do you have any pain or any of those things when you go to the restroom? Anything abnormal? Okay. And I'm just going to talk to her at this point about daily diet. So depending on what they say, I can make recommendations to have a little bit more intake of fiber every day into their diet. And now I'm going to ask my client to lay down and to raise their knees up for me. Okay. So this position is supine with the knees flexed. So what I'm going to do is inspect the abdomen. I'm going to inspect the umbilicus, the epigastric area. I'm going to listen for any pulsations. But you don't want it to be that strong in the abdomen. And I'm going to auscultate for 1 full minute in every quadrant, all 4 quads. Next, I'm going to basically say that bowel sounds are absent after 5 minutes. Next, I'm going to listen to bruits, and I'm going to turn my stethoscope around. And I'm listening, what a bruit is like a swooshing sound in the aortic area. The renal, the femoral, and the iliac. And yeah, that's me assessing the bruits. Next, I'm going to percuss the right lower and right upper, the left lower, and the left upper. So I'm percussing, sending vibrations. I'm taking note if there's any tympany or dullness. I'm going to instruct my patient to cough. Will you please cough? All right. Do you feel any pain at any point that I'm doing any of this?
Nope.
Okay. So I'm also going to, before I'm done with the abdomen, I'm looking at the texture and consistency of the underlying tissue. So if I notice anything abnormal, I make note of that and do further questioning if need be. Next, I'm moving on to her lower extremities. I'm going to do... Normally I would have my patients with no socks and shoes on, but I would inspect for capillary refill on her nail bed. I'm going to palpate and assess for the femoral, the popliteal pulse, the femoral pulse, the posterior tibialis, and the dorsal pedis. I'm going to also